So how do you know if your implants have ruptured, and what do you do if it has been diagnosed as ruptured? Hi everyone, I'm Dr. BBT and I'm a double-boarded plastic surgeon, and today we're going to talk about how to tell if your implants have ruptured and what you should do if it is. So first of all, it depends on if you have saline implants or silicone implants. If you have saline implants and your implants have ruptured, you would know right away because the side that ruptured is going to be deflated and very obvious that your implant has ruptured. Silicone implants, on the other hand, are a little bit harder to tell. If you have a rupture or a break in the shell of your implant, it's not very obvious. You can't really tell by physical examination or any other kind of clues other than the fact that you get an ultrasound or an MRI. Now, before 2021, the FDA recommended all breast implant patients get their implants checked by MRI. Nowadays, with the advent of high-resolution ultrasound, we can check for an implant rupture with an ultrasound probe right here in the office. And that will tell us if there's a break in the shell of the implant and if the shell is contiguous or continuous or not. What do you do if your implant is ruptured? Well, the FDA recommends that you remove your implants if the silicone has been ruptured. However, these implants these days are not like the implants that were once 20 years ago or more, where if there's a break in the shell, the silicone is floating all over your body. Nowadays, with gummy bear technology, which is basically a fancy way of saying cohesive implants with firmer gel, which means that if you squeeze it, it'll go right back in once you let go. And that's why it's called a gummy bear. It's just kind of like a gummy bear. So although it's not going to be free floating all over your body like it used to be, we still recommend you remove your implants. So what surgery do you get if you have a ruptured implant? Well, it also depends on if you have a thick capsule around your implants. A capsule is something that is normal, that is formed over your breast implants, over any implant in your body. And sometimes that capsule can be very thick and calcified. And if that's the case with a ruptured implant, that capsule needs to be removed at the same time. You may or may not want an implant replaced. You may want it downsized. You may need a breast lift. You may opt for a fat transfer, or any combination of that. So talk to your plastic surgeons to see what's best for you. But the most important thing is, if you do have a thick capsule, to remove it so that it prevents you from having any pain or distortion of the implant after surgery. How can you tell if your implants are ruptured, and how often can you check for this? Well, the FDA recommends checking 5 to 6 years after your original implant surgery. This could be with either an MRI or a high-resolution ultrasound that can be done in the office. After your initial imaging, whether it's an MRI or an ultrasound, you can get an ultrasound every other year to check to see if there's a rupture. Now, I always tell all my implant patients that breast implants are not lifetime devices. When you sign up for breast implant surgery, you're automatically signing up for at least 2 surgeries, one to put them in and at least one more to remove or replace them. And so it is important to know that at some point you got to either replace or remove those implants, because after about 10 years, the shell tends to erode and you might have a rupture. And that's usually after 10 years. However, with the newer implants on the market these days, it's possible that you're at 10 years and you get breast implant surveillance, there's no rupture, you're not having any issues, you may not need a surgery. More likely, your breast tissue may sag over your implants over the course of the next 10 or 15 years after you have them placed. And that's usually the most common reason for removing your implants if there's no issues. It all just depends on your breast anatomy and what your desires and goals are. Some people just don't want to have their implants anymore after a certain period of time, and that's okay. It just depends on what you want. So what are some causes of implants to rupture? Well, one common misconception is that during mammography, the tech sometimes pulls on the implant or pushes the implant, and they sometimes have you sign some waivers that say they're not responsible for rupturing an implant. But I will say it is exceedingly uncommon for a breast implant to rupture after a mammogram. So if you're worried about getting a mammogram, don't. Still go get your mammogram like you normally would. Very, very rare for your implants to rupture after a mammogram. Some other common causes is if you have repeated traumas or repeated mechanical stress to the implants, and your implant is over 10 years old and it's an older generation implant. Typically at around 10 years or later, implants shells tend to degrade over time, and that's why it's a really good idea to check if your implant has ruptured or not. Other times, if you're having a breast surgery or breast procedure, then inadvertent needle injury to the implant itself can be a reason for causing the shell to rupture. And lastly, although very uncommon, is if it's a manufacturer problem. Now, oftentimes the manufacturer or the breast implant company itself has a warranty on the implants. So if there is a rupture of the silicone implant, they often replace the implants for you at no cost, depending on the warranty and depending on how far along from surgery you are. If you're not sure, check with your plastic surgeon, and it's possible you can get your breast implants covered at no cost. So does the implant surveillance change whether it's for cosmetic reasons or for breast cancer reconstruction? It's a good question. The surveillance is the same, but the added extra surveillance that's really important is to check for breast cancer even if you're only checking for the implant. And that could be either with a mammogram or an ultrasound or an MRI, depending on what kind of breast cancer and breast cancer surgery you had in the first place. It's important to keep track of your oncological surveillance with your breast surgeon at the same time. If you've never had your breast implants checked or you're not sure if your breast implant has ruptured or not, you can go see a plastic surgeon with an ultrasound device and you can get checked out to see if you have an implant rupture.